There are two big changes that have come to aged care. Number one, the hourly costs are going to look higher. And number two, if you're approved for your home care services after September 12th, then the government's expectation is that you are going to contribute to the cost, even if you're a pensioner. That's got people really, really worried. And if you don't plan for it, you could get caught off guard. In this video, I'm going to explain what has changed, why it matters, and what you can do to stay on top of it. So before we look at the new prices, it's important to understand what's actually changing behind the scenes. So in the past, home care providers charged their services across three different ways. There was the hourly rate for the service itself. There was a package management fee, and that was there to cover the costs of paying invoices and making sure that the money was being spent in a compliant way. And then there was a third part, which they called case management. Now, this is the cost and the administrative burden that a provider experiences to oversee the care plan and making sure that care plan was updated in the right way so that it perfectly met the needs of their client. Under the supported home program, home care providers can only charge one administration fee for running your care. And that administration fee, called care management, will be set by the government at 10% of your funding amount. On top of that, the government is also enabling home care providers to charge an additional 10% on any invoices that are submitted for payment. So these invoices could be for podiatrists or cleaners or any third-party service requiring payment out of your home care funding that your home care provider needs to facilitate that payment. Now you might be thinking, well, Jim, that just sounds like two different administration fees in the supported home program world. And you'd be right. But here's the small and very important difference between the two. Under the new system, the government will only allow the case management fee to be charged on a daily basis, even if you don't have services. Any other administration fee, that can only be charged when you actually experience frontline in-home services. And what do I mean by these administration costs that can only be charged now when services are delivered? Well, these are the real costs that a business experiences when they put workers in your home. So the costs of training those staff, coordinating that staff, the systems and software programs and insurances that go into delivering that service in the home. These are the services and the administration fees that now need to be bolted in to the hourly cost of that service, rather than optioned out as a separate package management fee, which the government doesn't want that being charged on the days that you're not receiving services. So instead of the old system where some providers could actually tweak their numbers to make themselves actually look cheaper than what they actually are, I'll give you an example of that. A provider could potentially say, hey, our hourly rate is way below industry average of, say, $65 an hour when the industry average is about $85 an hour. They could go to market and say, oh, our hourly rate's only $65 an hour, but their package management fee and their case management fee was a lot higher, maybe even charging at the government cap of 35%. Okay. You can't do that anymore. Now the government is saying those administration fees, you need to put them all into your hourly rate. The benefit of that is now consumers only have one question to ask a provider. They simply have to ask, what's your hourly rate? Knowing that all their back-end administration fees are put into that hourly rate. And the consumer no longer has to ask, what's your admin fee? Because that's capped at 10%. The additional 10% on what they call the handling fee on invoices, that is optional for providers. So you could potentially ask, will you be charging a 10% handling fee on third-party invoices? But I'd say that most organizations will opt to charge that fee, particularly if you're with traditionally a self-managed home care provider or a co-care managed home care provider, because they really have no other way to recoup the administration costs that they have in running their business model. So when it comes to this particular point, it's going to appear that the hourly rate will increase for those standard services like domestic assistance or gardening or social support. But in actual fact, it's more like a shift in the administration fees being charged as a separate line item, just being bolted in to that hourly rate. And I suppose on this particular point, I actually agree with it, because as we said earlier, it's going to make comparing apples for apples in terms of the cost between providers really, really transparent. So what will the prices potentially increase to? Well, at the end of 2024, the government put a survey out to home care providers across the country. And this is when they were designing or figuring out the details of how the support at home program is going to be implemented now that they are restructuring the way case management fees are being done. They put a survey out and they said to home care providers, if you were to lose the package management fee and there was only to be one administration fee that you could charge on a daily basis of 10%, what would you need to increase your hourly rate to cover off all those other administration fees? So the government surveyed a bunch of providers and they came up with a summary of those results, and they published those results in March of 2025. And we can see that here. This is a document called the Summary of Indicative Support at Home Prices. And it's a guide showing what providers are expecting to charge under the new setup. And it shows here like a band of the different price ranges that different providers would charge for a bunch of different services. We can see the upper end of the spectrum, the lower end of the spectrum, and the median price that this survey revealed. So let's dive into it a little bit deeper. So as you can see here, for example, it lists the average price for domestic help, things like house cleaning, and it lists the median price as $95 per hour. Now, that might sound higher than what you're currently paying, but as we said in the previous few minutes, now you know why. It's because the administration fees are being tacked into that hourly rate now. Hey folks, a little side note, the Support at Home program is rolling out and the government has already specified that more changes are on the way. So if you're not already subscribed to our weekly VillageLocal newsletter, I encourage you to do so that you can stay ahead of the game. We publish updates, tips, tricks, and information without the spin on how to navigate the complexities of the aged care system. You can find a link in the description below and also in the comments. So make sure you subscribe to the weekly VillageLocal email newsletter. As I was thinking about these changes being implemented, it kind of occurred to me that it's very similar to what we see in other sectors, particularly professional services sectors. Take, for example, a mechanic. I've got my car in the mechanic at the moment. That my mechanic charges $120 per hour to provide his service. Now, and the reality is it's probably not him doing the service. It's probably his 20 or 30-year-old employee delivering the service that has a lot less years of experience. And I guarantee that young chap isn't earning $120 an hour. That $120 is covering all aspects of running that business. They aren't charging a separate administration fee or, equipment handling fee or parts ordering fee. There's no other administration fees. It's just $120 an hour, all inclusive. That's what the government wants the home care sector to move towards. But the point I want everybody to really zero in on is, yes, you're going to see price movements, but just make sure you keep your wits about you, because you're going to see communications from your provider with the pricing of their services. And if you're already getting services from a provider and those services are increasing, just take a sanity check on that price increase. And if you think that price increase is not reasonable in the sense that that price increase doesn't really equate to the case management or the package management fees that you were already paying, if that jump appears bigger than the package management fee that you're already paying, which essentially the provider is asked to put into it, well then ask your provider to clarify that price increase, because providers shouldn't be using this as an opportunity to grab greater profits. They should be just using it as an opportunity to reshift or reshuffle where they're incurring or recouping their costs. So just be mindful of that. Okay, so price increase aside, there is the other matter, which is the government is now expecting for people to contribute out of their own pocket to the cost of their services, regardless of if you are a pensioner. Now, I will say that what I'm about to say going forward in terms of this co-contribution, this only relates to people who were approved after September 12 of 2024. If you were approved for home care package services on September 12 or before, so that's officially approved, you received a letter from the government and that letter was dated on September 12 or prior to that date, then you will be grandfathered where you will not have to co-contribute. So kudos to you. But anybody after that date, September 12th, you will have to contribute to some types of services. And those services are broken up into 3 categories. That first category is known as everyday living services. The second category is called independence services. And that third category, that's what they're calling clinical services. And the 3 categories, they attract a different co-contribution rate. For pensioners, the government is expecting that pensioners will contribute 17.5% of the cost of everyday services. So that's cleaners, help with shopping, help with trips to the doctors. If the service, let's say it is under the supported home program, let's take that average rate of $95 an hour. Now, most home care providers, they're going to require a minimum of an hour and a half shift. Some providers require a minimum of 2 hours. But let's just say an hour and a half, $95 an hour, which is that median price that was reported in the survey. Some providers are communicating they're going to be charging higher than that. You'll find that when you do the math on that, the 17.5% of that hour and a half shift, that's going to leave the consumer about $25 or thereabouts out of pocket for that visit. Now, you may be thinking, well, that sounds very similar to what I'm already paying under the Commonwealth Home Support Program. And that is exactly the case. It's very clear that the government is of this position that under the Commonwealth Home Support Program, so that's the entry-level services, that's actually the most popular program that most people in the country are actually accessing. About 875,000 people get support services under the Commonwealth Home Support Program. And under that system, people are typically getting an hour to an hour and a half of domestic assistance per fortnight, and they have to pay out of their pocket about $25 to $35 for the visit. That's what essentially the government is trying to claw back when it comes to supported home program. And it's when I say claw back, the reason why I say that is because when people graduated originally from the Commonwealth Home Support Program into the home care packages program, what the typical experience was, the consumer no longer had to pay that out-of-pocket expense because they would start getting weekly support services in the home, and the home care package would cover the whole thing. The government's trying to reverse that trend, okay? But here's the rub. Under the Commonwealth Home Support Program, people were getting a little bit of domestic assistance, very entry-level services, on that fortnightly basis. So pensioners were paying that $25 to $35 per fortnight. Under the new arrangement where people are wanting to get some assistance on a weekly basis, is that $25 to $35 a week actually viable for a person who's on a pension? That's really the issue that's causing a lot of people challenges. So that's for the everyday living expenses. The next level up is that independence living. That's going to attract a 5% co-contribution from a pensioner consumer, okay? And then there's the clinical supports. That's for things like nursing or allied health or anything clinically related. that's going to be no co-contribution. I should say that independent living, that's things like personal care, showering, more personal caring stuff. And it's also worth mentioning that that is for pensioners, those co-contributions for pensioners. If you're a self-funded retiree or a partially funded retiree, it's a sliding scale. So it's not 17.5%. It may be higher than that. It will likely be higher than that based on your other income streams. And that percentage that you will have to co-contribute, that's mandated, or that will be published by Centrelink when you go into forming your support services. So Centrelink will do a calculation and let you know what your co-contribution fee will be. So as I was saying before, these fees being applied on a fortnightly basis have been hard for pensioners or any person on a fixed income. But when you take them to a weekly basis, we're seeing in the community already real challenges from an affordability standpoint. And it may be easy for the government to say, well, look, you don't need domestic assistance on a weekly basis. Go back to the fortnightly basis. You did that for years. Why do you want it on a weekly basis? But there's a human side to this as well, that policymakers, particularly those with no frontline experience with working with older people or being older themselves, may be failing to consider. And that is the human side of it. It's easy to see these support services as just practical help, cleaning the house, help with shopping, getting to appointments. But for many people, that weekly visit from that support worker may be the only meaningful conversation that they have with somebody all week. It's a laugh at the shops. It's a friendly chat while driving to a doctor's appointment, or just a check-in that reminds them that they matter. When visits inevitably drop for a number of people across the country because of affordability, when they drop to a fortnightly basis, it's not just fewer clean floors, it's fewer human connections. And that can take a toll and, in actual fact, totally undermine the whole point of why the government's doing this, which is to save money so that more people can access support. What is the true cost of negatively impacting social, mental, and emotional well-being? Well, we'll find out, won't we? So I do want to take this moment to highlight a very, very important point. The government knows that there'll be many people that desperately need weekly support services, but simply cannot afford them. And Minister Sam Ray is on record as saying that financial hardship assistance is available for people who need that support and genuinely cannot afford it. But here's the thing. Many people in our VillageLocal community, people I've spoken to personally, don't even know that these provisions exist. These provisions are not new. Claiming hardship assistance is not a new thing. That's been a policy that's been around for a very long time. Not many people know that it exists. And even those who do know it exists wouldn't know where to start when it comes to actually completing the application form. So to make that easier, we actually put together a step-by-step guide that shows you where you can get the application form and how to go about filling it out. So it takes away a lot of the stress and gives you some insight into how to make that submission process a lot easier. The mandate at VillageLocal and the takeaway from this video is we do not want you suffering in silence. And if you are considering cutting your services because you can't afford the out-of-pocket contribution, well, your first step should actually be get a submission in for hardship. I'll put a link in the description below for how to access that user guide as well. Make sure you check that one out. Catch you in the next video.